Qualified Health Center that was in Presidio and Marfa, they had been in existence for a couple of years, and they were struggling. And so I knew that it was honestly going to be better for my patients if I joined the Federally Qualified Health Center. And it was going to be better for me because I was probably going to be able to recruit a partner. I had tried to recruit people to come join me, and nobody wanted to come join me in private practice and lead the lifestyle that I was leading. So I joined Preventative Care Health Services. That's the name of our FQHC. And immediately, one of my former medical students, Dr. Katie Ray, became my partner. And we were in Marfa and Presidio at the time. And a couple of years after that, we applied for a new access point grant from the federal government, and we got an additional $650,000 to open up in Alpine. So now, as a federally qualified health center, our impact is this. We now bring in $2.1 million a year in federal tax money that supports indigent care that I wasn't able to bring in private practice. We now have 3 locations instead of 1 that I had when I was in private practice. We now have 4 family physicians. We have 1 nurse practitioner. We have 3 licensed professional counselors, and we have 3 dentists. We offer medical care, behavioral health, and dental care. And our malpractice is free because it comes from the federal government. When I think of the impact of my small, tiny private practice versus now what I've helped to create, we've now started a rural residency program last July with Texas Tech. That's what gets me excited, and that maybe we're starting to impact population health out here, regional health, by just the impactfulness of an FQHC and bringing in that federal tax money. And then what that enabled us to do is to build, more of a foundation of healthcare that was really, really needed out here in the Big Bend. It's still nothing like it should be. There's still so many health disparities that our patients have to endure out here. There's no mammography out here. And so a woman from Presidio down here, if she can pass the immigration checkpoint, has to go to El Paso. 250 miles to get a mammogram. 250 miles to see anybody but a family physician. They have to go see a specialist. You get on an accident out here. Level 1 trauma center is El Paso. Level 2 trauma center is in Odessa. And so that golden hour of trauma where, it's safest for a patient if they can get there within an hour to an ER. It's eaten up just in getting to the patient or getting the patient, to the ambulance. I kind of feel like, my role right now, kind of being mid-career, is to be more impactful and to do more of what I tell medical students and residents is practicing medicine outside the exam room. And that's advocating for my patients and telling my patients stories because of the unjustness of rural health care, of what these patients have to endure and have to put up with. It's just unfair, and it shouldn't be so hard to get good quality care. And I've just come to the realization that healthcare in our country is a privilege. It shouldn't be that way. It should be a right. What you can see is you're starting to see Presidio and Ojinaga. Ojinaga is the Mexican town of about 25,000. It's much bigger. Presidio of about 7,000. And then so all of these mountains are Mexico that you can see. So the Rio Grande snakes up this way and on this side of the mountains. Let's see if he needs anything. ¿Necesita agua o algo para comer?
Una border, por.
¿Mande?
Una border para que vengan a México.
Dulces.
Sí, gracias.
¿Y cómo no?
Familia, pero ya no.
Ahí está un poco de café. Debería de venir una migración aquí si quiere. Si eso es que quiere.
Sí.
¿Es todo?
Sí, es todo.
Okay. Bueno, suerte,
Thank you,
okay?
gracias,
Sí, que le vaya bien. Igualmente. He was wanting to be picked up by the Border Patrol. And this is the roughest place to cross out here just because there's no water, really limited water. And so they'll get dehydrated this time of year, hypothermic. Migrants die out here. I always just think, but for the grace of God, that could be me or my family. This area is called the llanas, or the lanas, the flats of Presidio. So none of these houses have running water. So HPSA scores impact federal funding for healthcare. So it allows us to get National Health Service Corps scholars and loan repairs to get their educational debt paid off out here, as mine was paid off. That's what enabled me to come out and have my educational debt forgiven, because I was willing to practice in an underserved area. This is the Mexican consulate here. Presidio was founded in 1683. The conquistadores, Cabeza de Vaca, came through here. Subway is the only fast food. Amazingly, there's not a McDonald's and there's not a Dairy Queen in Presidio. The Subway is the only fast food. So this is the road to cross over to get to the port of entry that we're taking. And we've been trying to recruit for years a physician to come and live in Presidio, and we've been unsuccessful. The last physician to live here full time was when I first got to Alpine around 2007. He left in 2008. And so since then, there's not been a physician living in Presidio full time. And about 75% of our patients here are Spanish speaking only. The other 25%, they have some knowledge of English, but would probably honestly prefer you speaking Spanish to them. But they're amazing patients, just salt of the earth type patients. But this is the main drag. You can see there's not a whole lot of businesses or economy going on. This is the only grocery store, and prices here, it's the same company that's in Alpine, but prices here are higher because of the transportation to get stuff here. Doing home visits here, we do home visits for patients that can't access it in the clinic or have challenges. It can be a really humbling experience to visit somebody's home out here. This here is the nicest housing in Presidio, and it's government housing, and it's the Border Patrol complex. So married housing is up here on the left, single housing is here on the right, and you can see that it's a very segregated community. So this is the clinic, and this clinic we opened in, I think, 2014 with a $1.4 million grant from the U.S. Department of Agriculture. The U.S. Department of Agriculture funds rural health, and so the city and us, we were able to get a grant to open this. And another perk from the federal government is we got a new access point grant 2 years ago to open dental in Presidio, because there's no dental. Again, another example of something I couldn't have done in private practice is get a grant to open up a dental office. All right, welcome to Presidio. Let me go introduce you to our amazing staff. This is Angela. Angela's our referral nurse. This is where we have our licensed professional counselor. Rogelio Zulia, he's our full-time licensed professional counselor, also from Presidio, and he speaks Spanish, which is a huge issue in behavioral health, is trying to find providers that can speak Spanish. Yeah. So this is the only X-ray machine in all of Presidio, and again, we got the funds for this from the federal government, from a grant from HRSA to debut radiological services in Presidio. And we hook up with a teleradiologist out of Austin, a group out of Austin actually, and in about 15 minutes we get a read back from a radiologist. So this allows patients to not have to travel to Alpine to get a chest x-ray, or if we think somebody's got a pneumonia, instead of having to send them to the ER in Alpine, 90 miles away, we can get a chest x-ray here and confirm the diagnosis. So there's no pharmacy in Presidio. So we carry a limited supply of some common antibiotics and common antihypertensives to kind of, until a patient can get access to a pharmacy. This is our soon-to-be pharmacy, hopefully. We're currently in this clinic, Presidio County Medical Clinic. We're in the process we've applied for a pharmacy license so that Presidio, a town of 7,000 people, has a pharmacy. But currently the process for Presidio patients to get their prescriptions, are that we can send them electronically here from our clinic in Presidio, and 2 of the 3 pharmacies in Alpine will deliver them to the bus station in Alpine, and then they'll arrive here later that day, the next day after we send in a prescription, and our staff goes to the bus station here in Presidio and picks up the prescriptions, and then the patients come here to pick them up. But soon, hopefully sooner rather than later, in place of these bags will be pill bottles of supplies of medicines for our pharmacists to distribute, so our patients don't have to wait a day or more to get their prescriptions.
My name is Manuela Avila. I am one of the dentists here in Presidio, and this is our dental office here.
And I'm really proud of Nellie and Jeremy that they're providing dental care in Presidio for the first time in full-time dental care that I can remember. I've never known in my 13 years of practicing out here for there to be full-time dentists out here. So she had her care in a federally qualified health center growing up, and now I love that she's providing dental care to a community and a population that otherwise would not get dental care. I think it's just a beautiful story of just coming full circle from being the patient to now being the provider. And her husband, Jeremy, his brother is a family physician in Fort Stockton, and Adrian Velasquez is his name. And Adrian rotated with me as a resident. Another recruitment success story of hosting a trainee, and this time getting 2 dentists. And not a doctor, but getting dentists, which are really harder to recruit than physicians are. So, and they live down here full time in Presidio, and I have seen them go out into the community and go to the schools and go to community events and start teaching, people about the importance of oral health, that it's really important for physical health as well.
We know that diabetes, hypertension, they're all, tied together in one way or another, so we have to kind of let them know the importance of taking care of their mouth and how it can affect, other medical conditions. So we're here available for patients to just try and reach out to them and let them know we're here.
In a socioeconomically disadvantaged area like Presidio, where it's hard to find patients that have dental insurance or medical insurance, and their payers are Medicare and Medicaid, which don't pay as well in a private practice model versus in a federally qualified health center where there's enhanced reimbursement for those payers, for the government payers. FQHCs actually get paid better to see a Medicare and or a Medicaid patient versus a commercially insured patient. So the payment model is kind of flipped.
Yeah.
That's the incentive that FQHCs, we want to see more Medicare, we want to see more Medicaid, because it actually pays more, and that allows us then to provide more indigent care for our dental patients and our medical patients. And so that's that FQHC model that's so unique and different than the private practice model.
Right now we're struggling a lot with trying to let patients know that what we're treatment planning for you is what you need. A lot of patients don't show up to a dentist unless something hurts. So when they come here and it's like, okay, I want an exam, and we sit there and say, you know what, you have 5 cavities, 10 cavities, when for them it's like, wait, nothing hurts, so are you really telling me the truth kind of deal? So they're not very open to preventive treatment. So that's the big challenge.
A big part of what we need to do every visit is education. In addition to responding to the dental and medical conditions that they have, it's just so vital. A team-based model of taking care of a patient is the best model of care. So having your dentist in-house, having your behavioral health in-house, having your primary care in-house, having a social worker to help with the social determinants of health, the challenges outside the exam room, having a pharmacist, having a pharmacy available, and then having your nursing staff and your receptionist. That's that team-based model. But they shouldn't have to leave. They shouldn't have to make the choice of, can I take off to go get my mammogram today, to take off the whole day? Or can I just come to the clinic and get it done and be done in 30 minutes and go back to work and go back to being productive and go back to taking care of my family? That's the just world that I dream about, and that keeps me here. And it's what I'm realizing is that I need to be more outside of these walls, practicing medicine and advocating and talking to different people outside of the Big Bend in order to affect, more change, for my patients here.